This meeting is now being recorded.
Hi, everyone. Welcome to the Early Intervention Monthly Technical Assistance Call, where we are going to be diving into the statewide meetings. So we are going to keep everyone on mute. Go ahead and use the chat if you have questions, and we'll get started. So our agenda today, we're going to be talking about the purpose of the call today, providing some information on problems versus polarities. We're going to be addressing the CCB questions that were submitted at the statewide meeting, focus on our actions for teaming and primary provider model, succession planning and sustainability, and independent contractors, which were all topics that we discussed at the meeting, and providing an update on the EI website, as well as providing some additional information for you today. So the reason why we are diving into the statewide meeting was to make sure that we're addressing the questions that were raised by the CCBs and making sure that we kept up to date on that information and provided you guys with follow-up, and that it didn't just kind of get forgotten about. So that's why we're going to be focusing on that today. Hopefully we will be, well, I know we are, not hopefully. We will be providing next steps on all of those points that of all the topics, so that you know exactly what our focus is and what our hopes to accomplish are. But also just a reminder to access all of the resources, the handouts, the information provided from other CCBs are on the Padlet from our statewide meeting. So at any time you can go back and reference those and get additional information.
Okay, thank you, Monty. This is Juanita, and as we worked through the questions that you presented to us at the statewide meeting, we realized that there are issues that can be resolved and addressed, and there are other things that we need to identify strategies to manage those issues. We're not going to necessarily be able to solve them. So we wanted to get everyone on the same page and have a shared understanding about when we're looking at a problem to be solved or a polarity to be managed. So we're going to go through that quickly so that you can get a sense of what we're talking about here. Let's go ahead and do it. Okay, so polarities are really some of those issues in early intervention that we're not going to be able to solve. They're really two different value points or points of view that are interdependent. And even though the values are different, there's tension between them and they need each other. So an example of a polarity would be breathing in and out. You can't breathe in without breathing out, and they're interdependent. Individuals and teams within an organization planning and taking action are other examples of this. So we need each other to be successful. They're part of our ongoing work. They're not going to go away. However, learning how to manage them can help with unnecessary conflict so that we can see the whole picture. Polarities do not always have an either-or solution. So when we're thinking in this way, we're allowing for both sides to be quote-unquote right with a both-and way of thinking. Problems, everyone knows what a problem is. It's something that can have a right or best answer and a solution exists. It has an endpoint. And oftentimes there's an either or best or right decision associated with that. So another example of this would be, thinking about catching a ball. So if I throw a ball to you, you have a problem in front of you. Either you catch it or you drop it, and it's done. It's resolved. Juggling is like managing a polarity because you're always trying to stay in kind of that upper two quadrants on an ongoing basis to really keep everything moving and managed. So this is just a quick visual of what we're talking about here, and when we go through the questions that you brought to us, we're going to identify if the EI team thought of them as a problem or as a polarity. So you can think of that in terms of some of our responses. Okay, so that being said, I'm going to turn it back over to Monica so she can talk about the structure of how we're answering questions today.
All right, so this is Monica, and just to clarify, there were some questions that were provided that definitely have a yes or no answer. Those questions, some of them are going to be incorporated into what we're talking about today, but we're also going to be sending out and providing you with a list of the questions that were submitted and then the answer. So everyone will have access to that information after the call. There were some questions that are maybe so, don't know. But basically what we discovered is that we either need some more information as to why, or specifics on what the question is. It wasn't quite clear, or they need more discussion. There needs to be possible outreach to CCBs or providers or individuals, or not just presented on this platform that we're going to be doing today. So just to give you a kind of understanding of how we grouped the questions. Laura is going to start us off with talking about the topic teaming and primary provider model, which was presented at the statewide meeting.
So teaming and the primary provider model were something we talked about at the statewide meeting. We had a lot of great feedback from everyone. Thank you so much for providing that. Beth and I took a look at all your feedback and the team as well, and have determined that we are going to prioritize teaming and start ongoing work to clarify the issues and answer the questions that you had. And we identified it as a problem because we think we can get this solved. The primary provider model is also something that has been identified as a problem to solve. You had a lot of comments and questions about that in your feedback as well. And we are going to focus on that, but we're not going to do that until after the Go For It activities have concluded. We're going to start working on teaming first. So one of the needs that you identified was that you wanted clear direction from the state on what actually it means to team, what that encompasses, what are the guidelines for that. And so what we would like to propose is that we reestablish a work group to work on revising the guidelines that the previous work group worked on quite a few years ago, decisions on what next steps for teaming need to be, and thinking about how then are we going to make sure everybody knows about the work of the work group once those final decisions have been made, and what training in TA may be needed to make sure that this is implemented throughout the state. So we will be thinking about the work group, and this is where you come in. Many of you at the statewide meeting said yes, you would be interested in participating on a work group to clarify teaming and what that really means. So we are asking for your involvement. We're looking from representation from broad members of CCBs, coordinators, service coordinators, staff providers, contract providers, families, any other stakeholders that might be involved. We do want to limit the work group to 12 participants. So if that is something you're interested in participating in, you can contact either Beth or I. Our contact information is there. And we really want involvement from those of you that are currently implementing, really using teaming as a way for your providers to share information across disciplines, and those that are not and are wanting to think about what that would mean. Because I really ask that those of you that are like, we got teaming figured out, we don't need to be on the work group, please be on the work group because we need your expertise. So let me talk just briefly about the primary provider model. We will be including some training on what that really means in the EI fundamentals, which is the online training that's due to roll out in fall of 27. It's included in the key principles for EI service provision, 2007. We're going back in time. 2017. It's included, as you know, very clearly in the EI principles for early intervention, the key principles for early intervention service provision, which you're all familiar with because we've referenced those throughout many things we've worked on. The concepts of teaming and the primary provider model will also be included in the EI certificate, which is something that's in the works. We're expecting that to be rolled out for a pilot in 2018. And then we'll be also providing targeted training in TA on this, and we'll probably be convening another work group to work on the primary provider model subsequent to developing the guidelines for teaming. And we've also included, one of the things you asked for at the statewide meeting was a request for video examples of teaming and the primary service provider model. So Beth has researched this and included some links. Some of these, like the Early Intervention Strategies for Success blog, is just a great blog that has all kinds of topics. You can use that as a resource for pretty much anything in early intervention you want to. So those links are there, and you can take a look at those to help you. And remember to email Beth or I if you're interested in participating in the work group. We'll be sending you out then a SurveyMonkey to gain more information about your representation. Do we have any questions in the chat? No? All right. Well, we're hoping that those of you out there are going to be interested in participating, and please, if you have others on your team that you think would be great to represent your community on this work group, pass the information along to them as well. All right, thank you.
And just if you guys think of questions, even if it's a topic that we've kind of passed, don't hesitate to type it in the chat, and we can see if we can address it. So moving on to succession planning and sustainability, which was another one of our main topics at the statewide meeting. This has also been identified as a problem to solve. EI Colorado has made this a priority, and we're going to be focusing on some ways to provide help around this topic by the end of this year. One of those is by revising, updating, and expanding the EI Coordinator's Handbook. So that project is in the works, and hopefully it will be more comprehensive and available to support you at your CCB with some additional information on how to do that in your community. A list of required training for EI coordinators will also be compiled in that for fiscal year 17 and 18. So that information will also help with this process. There is a question from Joy. Will these be two separate work groups, teaming and primary provider model? And yes, so since teaming is going to be the focus first, that work group will be first, and then as soon as the primary provider model becomes a focus, a separate work group will be convened.
We anticipate that there'll be some overlap because some of the folks that are working on developing the guidelines for teaming are going to be invested in wanting to move forward with the primary provider model as well, but they will be two separate work groups.
Yes. Okay. Also, resources that have already been developed by other CCBs. That was an ask from EI Colorado at the statewide meeting that CCBs shared some resources or information or tools that they currently use in their community. So just a reminder that those are still there on the Padlet in addition to the resources posted by the state. So and you can still add to that as well. So if you have something that you would like to share, please use that as a resource. Are there any questions or comments about succession planning and sustainability? Alrighty then. Well, Christy will talk to us about independent contractors.
So again, this was a topic that was raised as a priority by you all, and we recognize it's a priority for us as well, but we have identified this overall as a polarity that needs to be managed. And we will be focusing on this the next fiscal year. And we heard you many times tell us what you really want from us is some top-down state support. And so we are going to make every effort to assist and provide guidance and communication to the providers. So the current work that's happening is around a lot of work with our Alliance OEC task force. And we're working right now and having some discussions around a universal provider contract, which has been talked about a few times as something that you all would like and might be a lot better to manage, to have one contract that CCBs can attach addendums, and this is also a wish from providers so that if they're contracting with multiple CCBs, they would be able to transfer back and forth a little bit easier. We're also in the middle of developing an EI certificate training. We're anticipating that will probably be available by the end of this year, and the EI Colorado team will provide guidance as to what this means. and we'll be making decisions later on after we've gotten some feedback from providers and tweaked it as needed as to whether this may be a requirement for providers later on. We're also in the middle of holding some provider meetings. We had our first meeting with providers in the Denver area, and we'll be scheduling 3 more. And Beth and I are hosting these, facilitating these meetings, and we'll probably be reaching out to ask different CCBs to host the meetings, and we'll try to get around the state and do these in a regional way. Oh, sorry, I skipped. The other project we're working on, and this will be coming up shortly, is moving the provider database into the Unicorn. And so this is our last step to move all of the early intervention data components into one place so that we can link all of our data and be able to look at all of the provider information, automate some of the processes that we have in place around attestations and assigning providers to kids. And so that's exciting work, and that'll be happening coming up as well. So ongoing work that we have going on around independent contractors are working around some Medicaid issues, which we'll talk about a little bit later. We are improving our quality of our IFSPs. As everybody is well aware, we have our Go For It activities going on, and providers are definitely an integral piece of this. We're also trying to figure out how we can get providers more training and get information out to them. And again, moving them into the provider database will impact this, give us a little bit better access to providers and sending out information. Provider shortages are always an issue, and again, a polarity, something we just have to manage. And we just want to let you all know that this is something that we recognize. We want to put out guidance around helping you all figure out what you're doing, how you're recognizing when you have shortages, what you can do about those in your own local communities. And then we also are doing some work around identifying providers with specialized training. And again, the provider database will really help us with this. We'll be able to have providers that have that specialized training and feel that it's not being recognized, put that into the database, and CCBs will be able to take a look at that and be able to determine which providers have that specialized training as they have children that need it. And then we can figure out where our recruitment efforts need to take place. So one of the questions that was submitted to us was, can specific training requirements be added to the EI contract? The answer to this is yes. However, we already have language in our rules requiring the completion of training defined by the department, which of course is CDHS. And we did that purposely so that as we roll out trainings or we determine which trainings are appropriate for providers, that we've already provided the language needed. What we need from you all is input, talking about which trainings you're interested in requiring providers to take. And we can certainly support that. And as we mentioned, the certificate training may or may not become required in the future. But we also have to have sort of a more in-depth conversation around if we require specific trainings of providers, what are the consequences for those providers if they aren't taking the trainings that we're asking them to do? Are we ready to take a stance that we won't contract with providers unless they take training? And is that going to lead to our issues around provider shortages? And so I think that's a bigger conversation that we need to have in the future, but we do intend to have that conversation, and we really do need that feedback from you all. So the other question that we get a lot is how do we address the issue of Medicaid billing requirements not matching the EI model? And again, there's no simple answer to this problem. Medicaid is a critical resource for early intervention, and we are working collaboratively with the Alliance OEC Task Force and Healthcare Policy and Financing to try to align the two systems. We are working right now on a crosswalk of what the two systems require of providers and trying to determine if we are as far off from each other as we think we are. We feel like this is positive movement. It's going to be slow. It's not a quick change, but we do feel like this is a problem that we will be able to solve. I say hopefully, but we do believe that we can solve this problem. But it's just going to take time. Medicaid's a big system, and it's just not that simple to change things up really quickly. Meanwhile, services can be provided in alignment with early intervention best practice while providing documentation that's needed for Medicaid billing. Many CCBs have figured this out. Many providers have figured this out. And I do think that if somebody has figured out how to do this in a successful manner, we'd love to see any resources you might have, tips on how you're documenting the services so that it meets the Medicaid requirements and while continuing to feel confident that you're providing services in alignment with the early intervention model. So, how do we gain buy-in on the EI model from independent contractors? So, we know that research demonstrates that EI best practices produce better outcomes for kids. CCBs can always emphasize to providers that they look to those who follow the EI model first when they're going through their process for assigning providers to kids. And we do recognize that we need to provide more top-down information and guidance for you all to be able to convey to your providers. And again, more discussion needs to happen. We do intend to do this. We do hear you that we need to put out that guidance for you all to share, and then it becomes consistent across the state, and each CCB doesn't have to take responsibility for generating this information for their providers. So again, no easy answer, but we do believe that we are making good progress on this as we roll out our quality improvement practices, and since we have access to IFSPs and we will be able to link providers with quality IFSPs, we believe that we can make good progress in this area. Remember that it's already in CCB contracts that Part C must be followed, and so this is definitely something that could easily be generated in a contract with your providers. Do we have?
We have a question, and sometimes it feels like choosing a provider based upon the EI model is in direct conflict with the funding hierarchy. Which one wins out?
So that's a good question, and again, it's not a simple yes or no question. We've got to use all of the available resources that we have. We also need to have better conversations about really what are the conflicts between the EI model and following the funding hierarchy. And it's required to follow the funding hierarchy, and it's required to provide services in a way that's best practice for infants and toddlers. And so those really are the conversations that we're having. It's not specific to Medicaid, so it's a bigger issue than that. And so we hear you. We know that's really a push and pull kind of a thing that's going on right now. I wish I had a better answer.
I think you did fabulous.
More questions?
Any other questions about what we just talked about, independent contractors, or?
This is Beth, and I want to make one comment about independent contractors, and this has to do with the contracting cycle. Since independent contractors are all fee-for-service, they're not necessarily tied to the fiscal year, and so CCBs might consider changing the year, the cycle that you do your independent contractor contracts to help avoid some of the extra work that happens in July. So you could be doing contracts in October instead of July, and spread the work out a little bit.
Great.
Great suggestion.
All right, everyone, this is Ashley Ness, and I'm going to talk to you guys about some of the questions that were asked at the statewide meeting regarding everyone's favorite topic, the unicorn. So I am happy to report that some of the questions and issues have been resolved, and then some of them will be addressed within this next year, and then others we do need to put out for some larger feedback. So some things that have been resolved, so the IFSP end date was not taking into consideration the child's third birthday. This was resolved on 6/30, so now it is taking into consideration the child's third birthday. There needed to be an eligibility date on the Visual Force IFSP. That has been added to the Evaluation and Assessment tab. Need a field for the primary care physician fax number. That has also been added to their contact record, and that was added on 6/30. And then fixed IFSP type for in-state transfers. So if you get an in-state transfer, you can go ahead and enter the IFSP record type if it needs to be a periodic or annual. Without that child needing to have an initial, you'll need to make sure that you report that the that the referral source is the CCB, and then also report with the original one. So this was done back in March, and there was, I posted in the chatter on how to go ahead and document this. So if you need further clarification, feel free to email me. More things that have been resolved. So a question was a section to record additional medical comments. So on the Evaluation and Assessment tab, there is an area under the general health information where this can be recorded. And then there also is another comments box underneath just called Evaluation Comments that you can go ahead and enter information there. A request for reports on upcoming events or events that are past due. So this report has now been generated. It's in the Early Intervention CCB folder, and it's called Projected Meeting Dates. Go ahead and take a look at it. I'm very interested in hearing feedback of what works and what doesn't work on that report. So enhancements to the evaluation. So Beth, I'm going to address that coming up. So hold that question. So in the enhancement project, so I'm happy to report bilingual IFSP. We are going to be working on that. And we are anticipating that it will be rolled out in October, so it is right around the corner. We've received a lot of feedback about the Family Assessment tab doesn't really flow, so we're going to work on simplifying that. I would be really interested to have users join a guidance group so they can provide their feedback. So you can contact me if you would like to join a guidance group. Change the funding type on the EI Services tab. So once users save a service plan element, they can't go back and change the funding source. So we're going to work with the developers on making that editable. The evaluation comments. So here's your question, Beth. The evaluation comments on IFSP, it does not currently print. We're going to get that worked out pretty quick here. Discussing the transferring IFSP between CCBs. So we're going to talk to the developers about this and see how it works. So I can't give you a yes, this is definitely going to happen. We need to discuss with the developers on how this would work. The ability to add family members or IFSP participants without adding a contact. So again, this is something we have to discuss with them to see if it is a possibility. If a contact record for somebody that is participating in the IFSP meetings doesn't currently exist, ideally, user could go in and enter their contact and it would automatically create a contact record. I don't know if that's possible. We'll have to talk to the developers about that one. Clarification. So some things that I need a little more feedback from users is a way, so one was a way to not have all IFSP outcomes pull over from previous IFSPs. So this is specific if an outcome has been met, users are interested in being able to remove them from the future IFSPs. We need to put this out for a larger stakeholder feedback, see if this is something for, thank you, if this is something particular to one individual or one CCB, or if this makes sense for everyone at all programs. Oh, sorry. So currently you do have the ability to print individual outcomes. So if you don't want them all to appear on a printed, you have that option, and you can also reorder them. So you have the option to put the ones that haven't been met up top and the ones that have been met down below. Update IFSP after archive without contacting the state. So we do not have any plans to change the archival process. If you do accidentally close it prior to entering something, you can go ahead and contact me. So we can't make all fields required on the IFSP because if you think about it, if a newborn were to come in and you create an IFSP, if you go to close it and you're missing transition information, you're not going to be able to close that IFSP. So just make sure that you're double checking all of your work. Services change to AT automatically when the system thinks the service is late. So I'm assuming that this is what's happening is the user is entering a service that's beyond the 28 days of the consent and trying to save it, and then the system is just reverting back to you need to enter a reason why this is late. If this is happening with you, please contact me and I can give you guidance on how to go ahead and enter that. Reports. So let's see our full reports on upcoming events or events that are past due. So again, this is a new report and it's called Projected Meetings and it's in the Early Intervention CCB folder and it was implemented on 6/30. Again, go ahead and contact me if you have feedback on what's working with it or what you would like to see differently. The transition report requires info on children exiting prior to 2/9. So we're working on getting a new reporting software or reporting program. So once we have that, we're hoping that will be resolved. For right now, yes, those children will be staying on the report, but when I run the report and to get everybody's percentages, I take those children out, so they're not counting against you guys. Transition data not transferring into the transition details page. So all transition information, dates, and reasons why it could possibly be late is now all on the transition tab. This was implemented on 6/30.
Okay, thanks, Ashley. This is Juanita. So we had just a few outstanding questions that didn't really fit into a single category. So we're going to try to address those as well. So the first one is, will there be an opportunity to make suggestions for changes to the IFSP form or other processes? So we're saying maybe here because if it's related to the form and the functionality and how that's working in the Unicorn, that's really going to be part of the guidance group that Ashley is asking for participants to be a part of for the enhancement project. But in terms of how that relates to the IFSP process, the form can really drive some of those processes. And so that's going to require more input and feedback and discussion from you. And so as we get all of the cohorts through Go For It and everyone using the new form and the new process, then we're going to have an opportunity to go back and reflect and make adjustments and changes based on your feedback, because we can't really course correct and make changes when we have people still coming on board and using the new process and form. So, but in terms of functionality, we certainly welcome your feedback there. Okay, so this is just a quick, short answer to this question, and the handout that we're going to be sharing with you that Monty referenced earlier will have a little bit more detail around family assessment. The question is, does the family assessment need to be completed at each IFSP meeting? The short answer is no. It's required at the initial, and then at each periodic and annual, you're going to review that information and make sure that it's up to date and correct. Because you're going to need to think about gathering that information to inform your global outcomes, strengths and needs, and to conduct the rating and make sure you have accurate information. So you're not doing a full-blown family assessment at each IFSP meeting.
So this is Beth, and moving on, we had a question about billing TCM from the time a referral is received if the eligibility is documented. We addressed this in a communication brief that was sent out in the middle of June, and with it is a revised health insurance authorization form that is posted on the website that CCBs can use to obtain all of the information that they need in order to satisfy both EI Colorado and Medicaid. And this guidance is also relevant to re-referrals as well. So, is there additional 1/12 for seasoned coordinator salaries, service coordinator salaries? The service coordinator allocation was increased for this year, fiscal year 17-18, and CCBs can use that additional service coordination funding as needed to fund salary increases for senior service coordinators or service coordinator managers. And we're also continuing discussions with the Alliance and OEC Task Force regarding the need for increase in service coordination allocations. And so it's something we're definitely considering and working on to try and figure out. And then what can be done to support evaluation schedules over the summer and during breaks? First and foremost, plan as far ahead as possible and working with your child finds. Include your process in your MOU that you have with your child find. And when the MOU is not being followed, just be prepared to arrange for the evaluation to be conducted by the CCB using your either in-house or contract providers.
Yay! So, everyone, I hope, this is Bonnie again, I hope that you have had the opportunity to explore and view the updated EI website. So it went live on July 1st. And I know, we all know, and that there is information that may not be there yet or that may be missing. So, or if there's links that are not that are not working correctly, if you receive any error messages when trying to download any forms or anything, please let me know so that I can check on those and address them. We are trying to clean up the way that our website looks and that the way and how we post information so that it's easier to find. So one of the things that you will notice is that the established condition database also looks different. you will be linked to a Google Sheet that you can search for all of the reviewed conditions. And it should be working now. I know that was one of the things that wasn't working on day one, but so if you've haven't tried recently, it should be working now. But to get to the search bar, just hit Control F to bring up that search bar in the provider database, in the established condition database. And it'll highlight the condition that contains the words that you're searching for. So just make sure that there's a yes next to each condition, because if there's a no, that means that the condition has been reviewed, but it's determined to not be an established condition. So just a reminder, when you're viewing that information, it looks a little bit different. If you have any questions, like I said, contact me and I can help you with that. Monthly TA calls, Go For It Community of Practice calls, and Unicorn recorded webinars are still available. They are not posted independently on our website. They are still available through the EI Colorado YouTube channel. And once you are on the channel, we've started trying to organize videos into playlists so that they are easier to find, and you can search within those playlists. So there's playlists for TA calls, billing and training. All of the parent videos that were on our old website are listed there also. There's a category for Unicorn. So they're there, and you can search for them. I see there's a question that says monthly TA call does not work, and that's because it's not linked yet. So thank you, but thanks, Yasmin. But it is, just note that we're still adding information. There was a lot to sort through on the old website, and there was a lot to try and categorize into where it belongs on the new website. So it's not currently linked, but like I said, if you go to YouTube and you search EI Colorado, it will pull up all of the postings that we have and the playlists that are there. So, but like I said, if you have trouble finding anything, let me know. So just to let you know that we're going to continue to make changes on how we're organizing and posting and sharing information. One of the other changes, or how we're going to be providing information to you, is these calls also will be posted, or links if there are handouts that we're referencing on a Padlet. And that information, when it's all developed and posted, will be sent out to you as well, so that for each fiscal year, the information or the handouts, things that we're referencing, will be there. So it's not all independently on the website, kind of clogging up the pages. So just an update on how we're doing that. So just also a reminder, it's not too late to send us your photos of you and your group on the scavenger hunt. So please, we did get some great pictures already, and I believe they are on the EI statewide meeting Padlet, so take a look at those if you haven't. You can send them either via email or to a phone number that was on your sheet, which I'm sure you guys all have your sheet still because it was so much fun. But you can send it to 720-595-6712, and we can get that in those shared if you'd like. Also, year-end data. I know Ashley has sent a reminder out to everybody, and that those indicator reports or the reports are located in the indicator reports folder. So just a reminder that data is due August 7th. Please let Ashley know if you need assistance or if you have any questions about what that looks like for your CCD. Also, do you want me to? Sure. So also just wanted to provide just a little bit of information about an upcoming collaboration project that is happening between the Family Resource Centers and Early Intervention Colorado. The hope is that between these two resources and two programs that some contacts lists are made, some informational webinars are produced, some great local community contacts are made, and that the hope is that both of those two systems will be able to understand each other's referral processes and structure and collaborate better on providing families with great resources in their community. So look for a brief survey that is going to come out that will measure kind of the current level of your coordination. Even if you don't have any coordination, that information is needed so that they can focus more on what that looks like. Save the date. So one of the things that was identified and that we talked about also at the statewide meeting is really the time that we had for the assistive technology and the vision portion of the meeting was just not enough time. And we recognize that. So August 1st, there's going to be an assistive technology webinar from 11:30 to 12:30. This is different and separate from the regularly scheduled monthly TA call. So that if you're interested in that information on assistive technology, please join Laura and Beth and whoever else wants to help with that.
It's really going to be, we didn't get through all the materials, particularly the interactive piece that we had hoped to do with the case study at the state meeting. So we will be working on that during the AT webinar.
Yeah. And we want to make sure that service coordinators are participating in this call as well, because it will be important information for them.
Because we'll have a big piece on how to document it on the IFST and how to determine if it's truly assistive technology.
Perfect. It says on here that the date is to be determined for the additional vision webinar. However, I know that I think that was finalized this morning. Yes. So Laura, can you tell us about that?
And the same thing with the vision webinar. We went through the PowerPoint on vision at the statewide meeting, but because of the bad weather, you weren't able to connect with the vision providers and the representatives from Anchor Center that had planned to be up there to interface with you and answer questions. So that's going to be the focus of this follow-up vision webinar. We won't be going through all the same material you heard at the statewide meeting, but we will have the providers and Anchor Center there. We'll do a short informational presentation, and then you'll have the opportunity to learn who they are and to ask questions of them. And that is scheduled now for September 5th from noon to 1. Is that right? Noon to 1.
Yes. Yep. Great.
And we'll be sending out announcements for these as it gets a little closer to the date. Be sure and expand the audience for these. Just like Monty mentioned or Beth mentioned with the assistive technology one, anyone that you think needs this information, please invite to participate on these webinars.
There's a question from Margaret Davey. Was it Anchor or a shared vision that's going to be?
Both will be on the call. We'll be talking just like we talked about at the statewide meeting, how you can utilize privately contracted providers through a shared vision, and then how Anchor can also be a resource for families in early intervention, so they will both be on the call.
Great. Thank you. Also a reminder, the next TA call that's scheduled August 3rd is 90 minutes and longer. It's longer than the regular hour that is typically scheduled. That's because Bridget Burnett will be presenting her information on working with families. That was, we weren't able to have her at the statewide meeting because of the wonderful snow that we got that second day. So just a reminder, 90 minutes for Bridget's presentation.
Hi everyone, Ashley Fernie here. This is another reminder that the Family Outcome Survey was extended, so it will remain open for a couple more weeks until July 31st. And families can submit those by mail, online using the link posted there, or over the phone. They'll need their consumer ID to complete this survey, which is on their mailing. But if they call you and need that number, it's on the client contact in the contact ID field, or in the DDD consumer ID field. And if any family is having trouble completing the survey, you can send them my way. My contact information is up on the slide. And then just continue to encourage staff to remind families about that survey.
And that is all that we have for you today. Thank you all for being here and for listening, asking your questions. We have a couple minutes. If anyone has any additional questions, we are here to answer them. So just a reminder, we'll be sharing that information on all of the questions that were provided to us, so look for that to come your way. And
will that be posted on the Padlet?
And it'll be posted on the new Padlet, which will also be provided in the email that will be coming out after this call. All right, no questions. Thank you, everybody. Have a great rest of your week.